A hands-on, professionally supervised conditioning program. Medfit Rehab, Columbus Center, Athletic Department, Dufferin and Lawrence, 647-259-5481, medfitrehab.com. Hi, Joanne. How are you this morning?
I'm great, Zelda. How are you?
I'm fine. Nice to have you back. And things are back to regular times now. Holidays, a thing of the past for a long time coming up. Okay, so knee pain, hip pain, are those pains slowing you down? And I seem to talk to so many people that are having knee or hip pain and cannot exercise. I brought a friend of mine to the Columbus Center yesterday who has a membership. She has terrible pain in her hip and her knee. She couldn't go on the treadmill. She just stopped and she left and she said, "I'll wait for you in the cafe. I cannot do it." You know, I had problems with my shoulder, and I continued to push and push until the pain started to subside.
Well, sometimes that works for some people. Other people, for instance, your friend, for example, part of the problem is whether she has been diagnosed, whether she knows what those problems are, because it is important. There are many types of knee problems. Women are more susceptible to. Others, if you're very athletic, then you are susceptible to knee issues because of the type of exercises and activities that you do. And the same with the hip. With the hip, there's cartilage issues. You lose the cushion that protects the bones from being on top of bone. You can end up with pain. There's wear and tear. Muscle tendons are overused. If you've had a hip bone fracture, that's going to cause pain. Arthritis causes pain, bursitis. All of these different issues that are in the hip area can cause pain. The question is, what is the diagnosis? And it's important to see a medical professional to have that diagnosed first, because then from there, a program can be designed for you. Now, you may require treatment, which is just as important. They may put you on medication, anti-inflammatories. In, unfortunately, some cases, there may be a hip replacement or a knee replacement required. But it's most important to get diagnosed first. And then once you've had the knee hip replacement or any kind of treatment, exercise is number one key.
Okay,
and
but
that is part of the problem.
Yeah, that is the problem. You can't convince people, Joanne, of something foreign. To me, it's my breathing. Okay, exercise is part of everything I do. If I don't exercise, no matter, I'm going to get sick. But to convince someone else that people think they should lay in bed all day. They shouldn't work. They should take loads of aspirin or Tylenol or whatever. How do you get these people to change?
Well, normally when we meet people like that, it really means sitting down and having a serious conversation with them, because what you find is that they have no idea of why they're experiencing the pain. And even if they do have an idea of why they're experiencing the pain, they've not been told what they can do to relieve or reduce the pain. So when we sit down and we talk to them, we'll also assess them to see where they're at, or we'll send them to one of our health professionals like Dr. Tony Van Hoof, who would assess them as well.
Right.
And we then get a determination. What is the problem? Is it from arthritis? When it comes to the knee, a lot of times the pain is referred from the hip and other parts of the body. So those things have to be determined first before you can actually treat the person, and then before we can put them on a program. And once they've been assessed and we know what the issues and the problems are, we collaborate with the doctor or the medical professional. We design a medically supported, evidence-based exercise program. It's prescribed so that they can actually get better, feel well, and not be experiencing such pain.
Okay, so the point is you help yourself. If you're listening to us and you don't take heed of what you can do, then it's your own fault. But tomorrow we'll talk more about a stronger core, skipping the sit-ups and having the kind of exercises that will make you feel better. Thank you, Joanne. Always a joy to talk to you.
Always a joy.
Take
care. And this is all to your good health.
Thank you so much. Take care. Bye.
Take care.
Joanne James, founder and medical exercise specialist of Medfit Rehab, will improve your overall health through medical exercise. Contact Joanne on James, 647-259-5481. Columbus Center Athletic Department, Dufferin and Lawrence, medfitrehab.com.